I'm Dr. Soumya Swaminathan, the Chief Scientist of the World Health Organization, and I want to talk to you today about the pandemic, COVID-19, and the future of health. I'm often asked, is COVID-19 over? Is the pandemic over? This, of course, is a question that troubles all of us. While COVID-19 is no longer causing the same kind of acute threat that it posed in 2020 and 2021, under no circumstances can we think that it is over. It's still a new virus, it's a new pathogen that the human beings are seeing for the first time, and how it behaves and how the future unfolds is still unpredictable. We are still seeing cases rising in many parts of the world. There are new variants and sub-variants of Omicron. Currently, we are tracking about 300 of these sublineages of Omicron globally. At the same time, testing and surveillance has changed. People are testing at home, not reporting. Official testing rates have gone down. Sequencing of the virus has reduced. And people's behavior, of course, has changed. People have gone back to work, back to recreation and leisure, and there are many more opportunities now for people to meet and interact. And of course, when this happens in indoor settings or in very crowded settings, it gives opportunities for the virus to spread. So we could see this continuing ebbs and troughs over the next several months and years, but hopefully as our population immunity continues to grow thanks to vaccination programs, including boosters, and thanks also, or partly due to the natural infection that many people have been exposed to, we are building up that wall of immunity. So at the moment, I think we still need to be very vigilant. We need to continue our surveillance. We need to continue to manage our risks. So we have to assess and manage our risks, make sure that the vulnerable in society are fully vaccinated, 100% coverage wherever possible of elderly and of healthcare workers and frontline workers, including boosters. And we take precautions like wearing a mask if you're in a crowded place, opening windows, having good ventilation, maintaining hand hygiene, and so on. So while we can't fully predict how the virus behaves, we should be prepared, not just for COVID-19, but for the next pandemic, because we have now got such a good understanding of how a pandemic unfolds and what went well and what didn't go well, that we should definitely be better prepared, both nationally but also globally, to be able to face any such future events. So it all boils down to having health systems that are prepared, that are resilient, and that can cope. This means greater political will and investment and commitment to building the health infrastructure and learning from the lessons, seeing where were our strengths, where were the weaknesses, where were the gaps in the health system, and then trying to fill those and bridge those. There are a few critical actions that governments need to take in order to build and support health systems. Of course, we all know that surveillance is very important. Surveillance for known and unknown threats. And so we have to build that capacity. We have to build it at the community level, but we also need to build the laboratory infrastructure and the data systems and the ability to analyze and take action on that data. We need investment in research and development in order to be able to develop better diagnostics, therapeutics, and vaccines. We need to build public-private partnerships where there is government investment and government stewardship so that we can meet the needs of public health, not necessarily just leave it to the market to determine where the R&D should happen, but really outline the national and global priorities and the gaps, again, which need to be filled by the private sector, but with government support and a good framework for affordable access to those products, so that when government is investing, or philanthropic organizations or public sector funds are being put into R&D, the products of that R&D must be made available to public because they become common public goods. We need to expand and invest in health infrastructure, in health technologies and innovations, in a digital backbone which proved very, very vital during the pandemic and which is going to play a bigger role in the future in delivering healthcare, particularly to people who find it difficult to physically access health facilities. But at the heart of all that, we must remember that we have to place equity at the very center. And if our systems are built on foundations of equity, then we are likely not to leave anyone behind. Finally, we have to invest in people, because without human capital, systems are not going to work. Technology cannot solve all of our problems. Our healthcare workers, doctors, nurses, and other frontline workers did an incredible job during the pandemic, and many of them lost their lives and they sacrificed themselves to care for patients. But we must invest in the workforce, in training, in making sure that they are paid well, that they are looked after well, that they have personal protective equipment, that they get feedback and inputs, and they have a career progression pathway and opportunities to constantly skill themselves. So the pandemic has shown us the gaps, but has also shown us many opportunities. And the fact that science and technology and innovation can help find solutions to many of the problems that we face today, not just in terms of pandemics, but other public health issues and problems. So increasing investments in the health system will ensure that we come through this pandemic, but also that we can face future threats. And the fact that we have lost ground on many other diseases because of the pandemic, that we have fallen back in the achievement of our SDG goals and deliverables, means that we have to accelerate. We have to run faster to catch up. In the next 7 years, as we get to 2030, we need to be getting close to the goals that we set for ourselves. The biggest lesson from the pandemic for me is that health is the biggest investment in ourselves, our communities, and our countries. And if a country is to be economically successful, then investing in health should be a high priority. It should not be seen as a cost, but rather as an investment for future generations. Thank you.